Thank you very much indeed, Count Cora. We talk about health insurance here today, Minister. The problem is those who are paying health insurance, they're coming to me asking them to take them to Northern Ireland for an operation because the health insurance is no longer working for them. So they're waiting lengthy periods of time after paying huge money for health insurance every year, and still have to go away and pay up front for a reimbursement operation, partial reimbursement. But I've had people with cataracts, with knees, with hips coming to me with the same issue. The private health insurance isn't working anymore for them. And how can that happen, Minister, when you're talking about some people paying 3,000 and 4,000 euros and to find themselves in a disastrous situation? I'm on the phone when I go to somebody that's in the same situation, has a private health insurance and has decided he can't stick to pain, he can't wait any longer. So he was told he'd have an operation sometime next year, but that's not good enough if you're in pain. 47% of people have health insurance, and I suppose, you know, for those who are, and I said, and the best of luck to them, they're paying big money, they deserve to have their health seen after in a much quicker fashion than is what is happening at this present time. So all I'm saying is that you have people, you know, we have to think about the people here that can't afford health insurance. Some of those can't even get a medical card because they're falling between two stools, Minister. And you have that dire situation here. And I'm very, very strong, and our policies show that too, that everybody that has cancer in this country should get a medical card. And that is not the case, Minister. Rabbit argued with me strongly recently that they can, but not unless you have terminal cancer. And if you have, but to be honest with you, out of respect to everyone who has any cancer ailment, the least they get is a medical card for the period of time that their cancer exists. And obviously, when they're cured with the help of God, that they at least their medical card could then be given back. There's all sorts of, you know, we've spoken, I think, already today in relation to cancer, to healthcare. In here, healthcare is very much at the bottom of the barrel in relation to our state. We seem to have loads of money. There's no question of a doubt about the amount of money that's there. Fortunes of money, but it's been thrown everywhere and anywhere, but not getting to where it needs to be got. So basically, the biggest thing is if a person is in dire pain, whether it's a hip or a knee or whatever, pain for us, and can't have an operation for 3 to 5 years, there's something wrong. Or going blind and can't have a cataract surgery for 3 to 5 years, there's something wrong with the system. It stinks that I am Minister, and there's no point in we saying any different. It was the same issues that brought down the last government, and nothing has changed and nothing has improved since. And we have such, you know, people in this country, as I said, travelling. You cut the reimbursement for the cataract operation. That was shameful, absolute shameful what you did to the people. And not alone did you let them go blind, but no, when they had a small bit of an opportunity to get a little bit of reimbursement back, what did you do? You pulled the plug on that and cut it down to half. Punish them more. Make sure they go blind. So that's it. So, no, Minister, excuse me. There's a lot of things you know in health better than myself, but the patients that were paying 2,000 euros, they were getting, 2,000 back, they were paying up front, they were paying about 2.5. It was costing about 500, they were quite happy with that. They'd rather be done, of course, locally. They're now paying 1,000, they're getting 1,170 back. That's what they're getting back, I know it. I'm dealing with it every day of the week. That's almost half of what they were getting back before. So you can't say I'm wrong. Minister Rabbit is saying I was wrong before. According to her, everybody that has cancer gets a medical card. My God, if that's the case, she must have a very special situation in her constituency because it's not happening everywhere else. But we have it all the way right through, Minister, from the birth to the death, basically, or to where all the people can't get a nursing home bed. We have Apari nursing home in Bantry, in Belgooly, in Connaught, when he should have intervened. The health system in this country is failing the elderly people in this country who paid in and worked mortally hard. A lot of them did. And you've let the people down, shockingly let them down. So I'm saying, no, Minister, that's the least you do, is he should purchase these nursing homes that are being put out of operation for some reason or another, and save the people, at least the people that have the bid in Bantry, Belgooly and Connaught would continue to have that.
Minister.
Thank you very much, Ken Corla, and can I thank deputies for their support of the bill. It is greatly appreciated, and I look forward to going to committee stage Now, what I'm going to do with the time I have is address some of the other issues that colleagues raised. And whether I should or not, I'm going to start with the contribution from Deputy Boyd Barrett, because I listened to probably 5 minutes of misinformation during Leader's Question, which Deputy Boyd Barrett brought in. And I do now have a chance to respond, and I'm going to use that because Deputy Boyd Barrett, Cian Corla, stated very clearly that no progress is being made. He sets himself up as the champion of our healthcare workers, and he says there is no progress being made towards universal healthcare or sláinte care. So our healthcare workers have halved the time people wait for an outpatient appointment. Deputy Boyd Barrett says that's irrelevant. They have revolutionised women's healthcare. Deputy Boyd Barrett says that's irrelevant. They've brought in IVF, free contraception. They'll be about to bring in free HRT. They brought in specialist services in menopause and endometriosis. Deputy Boyd Barrett says that's not progress. That's not relevant to anybody. They have invested in cancer services. Cancer survivorship rates are getting better and better and better in our public hospitals. Deputy Boyd Barrett said that's not relevant. It's not important. That's not progress. We have massive new community-based services in and around his constituency, mine, and everywhere else. Deputy Boyd Barrett says that's not relevant. We're not making any progress. The healthcare workers aren't making any progress. We have had a massive reduction in costs for patients, but apparently that's not progress and it's not relevant. Apparently free IVF, free contraception, 500,000 more GP cards, apparently these things are not relevant. They are relevant. And I want to acknowledge Deputy Cullinan, Deputy Shortall, Deputy Berry and others who, at least whilst rightly holding this government to account, to their credit, do acknowledge that our healthcare workers are making things better for patients. Is it better across the board? It is not. It is not. But let me tell you, the waiting times in this country, our healthcare workers have brought the waiting times down from over 13 months to 7 months, and we are going towards the agreed sláinte care targets that no one waits more than 10 to 12 weeks. But apparently that's irrelevant. All of the progress that our healthcare workers are making, apparently according to Deputy Boyd Barrett, it doesn't matter. Well, it does matter, and we are making progress. And I want to fully acknowledge the point that was put to me by several colleagues saying, yes, progress is made, and they asked me, but will I accept that we are only some of the way there? 100% I will accept that. I think we're about half the way there. I think we're about 4 years into what is an 8-year turnaround to get to where we all want to get to, which is universal healthcare. It is the single-tier public system envisaged under sláinte care, where care is affordable, care is timely, care is high quality, and the new services exist. And contrary to some of the misinformation that we hear in this chamber and elsewhere, contrary to that, I want to acknowledge that the healthcare workers in this country, the doctors, the nurses, the health and social care professionals, the Department of Health officials, the people working around this country, our GPs, our pharmacists, they are working night and day to make things better, and they are succeeding. Now that doesn't suit everybody. There are some people in this chamber who want the public to believe that we live in a failed state, that everything in healthcare is terrible. Everything in healthcare is not terrible. Things are getting better every single year. They're getting better every single month. Are there parts of our healthcare service which absolutely do not work for patients? Yes, there are. Of course they are. But you know, just this week, after years of work, we were able to announce really important progress on children's spinal. We were able to announce that this year the number of children waiting more than 4 months will fall from 86 to 20. It's still 20 too many, I fully accept that, but 86 to 20 in 1 year, and all 20 of them in consultation with their surgeons will be offered care in the United States. And I appreciate the facts don't suit some members of this House. I appreciate the facts don't suit the failed state narrative, that our doctors, our nurses are achieving nothing on behalf of patients, but they are. I work with them every day, every week, every month. I've worked with them for 4.5 years. They delivered one of the best results on COVID anywhere in the world in terms of excess mortality, right? And the improvements that I'm talking about have been achieved by our healthcare professionals, and I want to acknowledge that. We spend a lot of time talking about hospital-based care, quite rightly. But look what has happened as well in community-based care, again, as called for under Sláinte care. In my own constituency, we don't have a big hospital. We don't have a Model 3 or a Model 4 hospital. But just in my time, I've opened 4 primary care centres in Wicklow, in Bray, Arklow, Rathdrum, Baltinglass. Planning permission has gone in Greystones, and there's going to be an expansion in Wicklow Town. That's just in Wicklow. We've given a huge amount of money in terms of daycare centres, Meals on Wheels. We're expanding the community nursing centres. We've allocated €5.5 million to the cancer support groups all over the country. Again, just in my constituency. It's Purple House in Bray, Greystones, Wicklow Town, Arklow, Rathdrum, Roundwood, West Wicklow. And that's just some of the community-based improvements in healthcare in a county that doesn't have a major hospital. And so, again, Corla, I'll finish on that, and I apologise if I'm a little agitated. But I come in here again and again and again, and I hear certain deputies in this House saying nothing is improving. The deputies over here talked about cataracts. Here's what's happening on cataracts. Until this government came in, the waiting time for cataracts for adults, where we stand now in Dublin, was 5 to 6 years. It's now less than 12 months and falling to the agreed Sláinte care targets. Children who were referred in for specialist care. Now, I appreciate you don't like the truth. I appreciate that. I appreciate the truth doesn't suit you, right? Fully appreciate the truth doesn't suit you.
A little bit of manners, please. Let the Minister reply.
Democracy may not suit you, the truth may not suit you, but our healthcare workers have reduced the waiting time for children in the Dublin area and other parts from 2 to 3 years to 6 weeks. Now, what about in your own area? You're aware of the really important investment we're putting into Ballincollig. You're aware we've taken the cataract surgery out of CUH, we've put it into the Royal Infirmary and Ballincollig. And if you look at the figures, what you will find, I fully accept it's not fixed. I fully accept we're not there yet. But what you will find, Deputy...
We're not I asked you that question.
The democratic debate may not suit you. I fully appreciate that.
Why did you close down to the answer
appreciate
that?
the parliamentary debate.
Why did you close it down?
And I appreciate that the record investment into healthcare in Kerry and healthcare in Cork doesn't suit your election campaigns. But it is nonetheless true. And no matter how much you shout at government, no matter how much you come in here with false information, it is a fact. It is a fact.
Please, Deputy.
It is.
No, please. You're making this into another Hall's Pictorial Weekly. Would you please? Sure, he's not here to answer that particular question. Will you resume your seat, please? Will you let? It was, but this isn't. This is not a comedy show. It is not a comedy show. Would you resume your seat? Resume your seat, Deputy. Please. Please. Now, can we... Deputy Collins, would you please let the Minister respond?
It may not suit you that there is record investment going in. And by the way, not for a moment am I suggesting that everything is fixed. Deputy Cullinan, Deputy Shortall and others have quite rightly pointed out that we have several years to go. But it is undeniable that our healthcare workers, who have been hired in record numbers, are turning this ship around. In my constituency, in your constituency, they are doing that. They are turning it around. They are reducing waiting times. They are rolling out new services. And Deputy, you can shout as much as you want, but it will not take from the improvements that healthcare workers are making in your constituency and in mine. Gurmagad Count Corla.
Thank you.